Hello and welcome back, our dear viewers, with our second guest for today in this beautiful episode. During the blessed month of Ramadan, many daily routines change, including how and when medications are taken, and for patients managing chronic conditions or short-term treatments. This adjustment requires careful attention and proper guidance. Today, we are pleased to host a distinguished pharmacist who will shed the light on the importance of medication education during Ramadan, how to safely adjust dosing schedules between iftar and suhoor, when it is essential not to delay certain treatments, and why consulting healthcare professionals is crucial before making any changes. We look forward to an insightful discussion that will help our viewers make informed and responsible decisions throughout the holy month of Ramadan. Please join me in welcoming our guest, Dr. Abrar Makhseed, pharmacist in this beautiful show. Welcome to the show.
Thank you so much. My
How
pleasure.
are you doing so far?
Alhamdulillah, thank you so much.
That's really awesome. So during Ramadan, a lot of people are worrying. They would like to fast, but they don't know, should we fast or should we break the fast? So what's your intake on that?
Before Ramadan, it's better for the patients to go to the doctor and ask the doctor if it's safe or no. The doctor will decide depending on many aspects. For example, their vital signs, blood tests, their medication adherence. So it depends on each patient.
Each patient, that's really awesome. And for people, our patients, why is it important for them to seek for medical attention and to also consult a pharmacist during this month?
Okay, so because the pharmacist will ask the patient about all the medications they are taking, the supplements, vitamins, hair pills, and will ask the patient about the fluid intake also. So
to help them understand their cases?
Yes, to understand the case, and then the pharmacist will distribute the medications throughout the non-fasting hours, depending on certain aspects like drug-drug interactions, drug-food interactions, whether the medications are better to be taken at suhoor or iftar, and that's why medication management is not just about moving all the medications in Ramadan to the night time. Yeah, it depends on the drugs itself and the patient condition.
Okay, so from what I'm understanding, there are some moments where they should take the medication even before iftar, right?
Yes.
And that depends on the condition itself. What kind of diseases or illnesses they should break the fast and they cannot continue until after the fasting period?
Okay, so regarding the breaking the fast, if there are some signs and symptoms like confusion, dizziness, if the blood sugar level drops below 3.9 or rises above 16.7, especially for diabetic patients.
Okay.
And for example, if the patient fainted, if there is shortness of breath, chest pain, all these are warning signs, and then the patient should break their fast immediately and seek medical attention.
Seek medical attention. Otherwise, there are going to be some negative impacts?
Yeah, sure.
So that it's not only for chronic diseases, also for the normal diseases as well. They can break the fast?
Yeah, depending on many signs.
Okay, and sometimes some people, they try to make the medication intake only in a specific moment. What's your perspective on that as someone who's professionally expert in the subject?
Distributing the medications during the non-fasting hours depends on many factors. The possible drug-food interactions, drug-drug interactions, whether it's better absorbed on empty stomach or it's better to be taken with a fat meal. So let's give an example.
It can make a big difference.
Yeah, sure.
In the health of the patient.
Yes. For example, if the patient is prescribed an antibiotic called Tavanik, and he took it with dairy products, the absorption of this antibiotic will be decreased. So we always...
the treatment will not be effective?
Yeah, it will decrease the absorption and the effectiveness.
Okay, interesting.
Yeah, that's why when a patient is prescribed Tavanik, we always tell them to separate it from dairy products at least 2 hours. Also, some medications may have some side effects like increased urination. For example, Lasix. It's a diuretic, so this medication, it's better to be taken at iftar time than suhoor time. So the patient
have time like to like make the necessary needs instead of like after suhoor when they about to sleep. Is that what you're trying to say?
Yeah, it's better. And some medications may cause drowsiness or dizziness, so it's better to take it at late night, not at iftar.
Or like in the morning period of time.
Yeah, but during Ramadan he cannot at morning,
Exactly.
so at late night.
Late night.
Yeah, or before imsak. So these are some factors
And
that
since we are talking like about the factors about taking medications, I realized like when I used to have like some illnesses, you know, and going like to the doctor, then the pharmacist will prescribe for me like some medications that I should take on empty stomach. I will take it because I'm not like expert in the field, but as someone expert. So why specifically on empty stomach? What does that mean?
Yeah, empty stomach means not eating for at least like 1 hour.
Okay.
Because some medications, if they are taken on empty stomach, it may cause stomach irritation. For example, some painkillers like cataflam or brufen. And they should be taken after food. Some medications, if they are taken on empty stomach, also may decrease the absorption, because food increase the absorption of certain medications. They are more absorbed if they are taken with fatty meals. So also the drugs, some of them, the mechanism of action is better on empty stomach, depending on the acidity. They rely on the acidity of the stomach. So that's why, yeah.
That's really interesting. And I believe it was like a puzzle for a lot of the viewers, but now Dr. Abrar has helped us to uncover this puzzle and continue. During your work time, like in the pharmacy or like in the hospital itself, there are a lot of patients. Do you remember like one kind of situation where like a patient was having a severe illness or something that happened because they didn't take medication on time?
Yeah, sure, because some medications are very sensitive to time. So if they are not taking it on time, the effect will diminish. So yeah, I saw some patients, and some of them, like sometimes their medication is not available like now. So I always advise them to go to the doctor to change it to a good alternative.
Like to schedule it.
Yeah, no, to give them a better alternative, and
they
not
are sensitive.
Yeah, because sensitive. Yeah.
Okay. And during Ramadan, some people, when they are trying, like specifically like the patient, when they are trying to fast, what are some signals or like symptoms they have to watch for?
They should watch for the blood sugar levels, especially diabetic patients. They must check for symptoms of low blood sugar and high blood sugar, despite the level of the blood sugar. Maybe they don't have the device now to check the blood sugar. For example, if they experience shortness of breath or confusion, these are some signs and signals.
And I think this is like a really powerful message and awareness for not only the patient themselves, but also for the people around them. For example, like the managers at work, sometimes when they see some cases, they might think they are just like, as we say in Arabic, like idalla, or he's not like being serious. So what kind of advice you would like to share for those people?
I always advise the patients and the caregivers, or as you said, the managers, to just search for these signs and consider helping those patients once they have these signs and symptoms.
That's really amazing and a good advice for a lot of people who have authority, and to take care and have some empathy, since we are even like in Ramadan, and it's one of the virtues that we have. You know, like sometimes antibiotics and also like some supplements, could they be like a good supplement for, or like a replacement for the medications during Ramadan, and are they safe?
Generally, yes, they are safe, but there are some precautions. As I said, some painkillers may irritate the stomach if they are taken on empty stomach, so it's better to be taken after food. And regarding antibiotics, yes, they are safe, but it's better to take either once or twice daily medication regimen, because 3 to 4 times daily medications are, as I said, hard to distribute throughout the day, and they must be taken after food. and some of them affected by dairy products like Tavanic, as I told you. And
or the type of food that we are consuming.
Yeah.
And you know, like during after iftar, mashallah, like a lot of people, the whole family, every one of them bringing their own special sweet and dessert and a variety of dishes. So,
right.
by the way, what's your favorite dessert during Ramadan?
Kanafa and my mom's قطايف.
قطايف.
Only my mom's
Your mom's
قطايف.
قطايف.
Yes.
Not anyone other's mom قطايف.
Yes, my mom's قطايف.
Allah يحفظها لكم. And sometimes like people, you know, like with sweet and different desserts, could that like really affect the treatments of the medication or the way they work?
Yeah, sure. Increased caffeine intake will alter the absorption of some medications and may increase dehydration. And also fatty meals may alter the absorption of others. Excessive sweet eating is also not a good thing because it will affect the blood sugar levels and may cause some sugar spikes, which is a really warning sign in diabetic patients. So yeah, sure, they affect the medications.
So they should just like take a very good balanced amount to enjoy it, not like to excessively having overweight.
Yeah, moderation and balance is always the key, to maximize the maximum effect of the medications and to ensure patient safety.
That's really a beautiful way to conclude our interview for today. Moderation is always the key for a safe lifestyle and a lifestyle away from all the illnesses and diseases. And with that, thank you and much appreciation to our Dr. Abrar Makhseed, pharmacist, for enlightening us about this beautiful topic and helping the patient understand how they can fast during Ramadan.
My pleasure. Thank you so much for the invitation.
Thank you so much. And now, dear viewers, we're going to take a quick break and then we're going to be back. Stay tuned.